Nicholas Thornton on a day out in the summer with his mother and brother. He's a 28-year-old man with autism and learning difficulties who is currently an inpatient at Rochford Mental Health Unit in Essex, despite having no diagnosed mental health problem. He is non-verbal but is able to reply by typing. When we met them in August, his brother Sebastian read out his words.
It's like torture that I can't get away from the alarms and everything.
Now Channel 4 News and The Independent have seen a safeguarding report ordered after concerns were raised about Nicholas's welfare and care. It makes for disturbing reading, with allegations that he is not being fed properly and that he is kept in a secluded and locked room with no windows.
We have seen photos that are too distressing to broadcast, but they show soiled linen in the corner of Nicholas's bedroom, flies on the ceilings and walls, an uncleaned toilet in his bathroom. His mother said the stench was unbearable. We've also seen photos of Nicholas lying on the floor. He's fallen out of bed because there are no railings. This report, this safeguarding report, has substantiated the complaints of psychological abuse and partially substantiated the complaints of physical abuse.
We were able to speak to Nicholas from that room, though it was dark because he cannot bear the light.
I know I've asked you this before, but where would you like to be?
Somewhere that understands autism and can meet my needs. I just need to be out of here and can't understand why I'm still here when I shouldn't be, and Essex just keep delaying and making excuses all the time and don't do anything.
Nicholas's care is commissioned by Essex County Council. He's had 15 placements over the last decade, many of them in inappropriate settings. He's suffered violence and abuse. In one instance, a staff member tried to smother him with a pillow. He also spent 18 months on the general ward of a hospital after Essex Council told his then care provider to leave him at A&E. The safeguarding report has found that
all parties involved believe Mr. Thornton's placement to be inappropriate and unable to provide the care he needs. Staff are not specifically skilled to work with autism. That he has fallen from bed because it has no rails goes further to show the inappropriateness of his placement. The relationship between Mr. Thornton and the ward staff has broken down and does not appear to be salvageable. He should be placed in autism-specific care as soon as possible, and Essex County Council should expedite this placement urgently.
Has there been a breakdown in the relationship between you and the staff?
They never understood me, my needs, autism, etc. anyway, so there can't be a breakdown if there wasn't one in the first place.
Is there something you want to say, Sebastian?
Every time me and my mum go to visit him or take him out, we're having to do his personal care ourselves because the hospital aren't doing it, which I didn't imagine that I'd have to do, but it needs doing because he can't live like that.
neither of the organisations responsible for Nicholas's care addressed the majority of our questions. Essex County Council said,
"We are carefully considering the concerns raised and will work with the NHS body and the family to take forward appropriate actions in accordance with our procedures."
And Essex Partnership Trust, which runs the unit, said,
"We ensure that all patients are treated with compassion and that we provide care designed to best meet their physical and mental health needs."
The charity MenCap campaigns for people with autism and/or learning difficulties to be moved from hospitals into the community, but they said there are several sticking points.
One is the perverse funding incentive. So if people are cared for in their communities, which we know is much better for people, the local authorities have to pay. We know social care budgets are really squeezed. If they're in a mental health hospital, it's the NHS. The other things, lack of accommodation. You do need quite specialist accommodation in communities, and you do need a decent social care system as well to support it all.
In fact, we have now learned that Nicholas was recently offered an appropriate placement in the community, a chance to be back with friends and family. The council has refused to confirm whether it has considered this option.